So we reviewed the overall pharmacokinetic parameters of absorption, distribution, metabolism, and excretion, as you can see those here. And it should be pretty clear that monitoring the movement of drugs in a patient is going to be important to avoid toxicity in your patient and to ensure that your patient has the optimum response. There are three important pharmacokinetic variables that work together that are related to each other, and these are the volume of distribution, the clearance, and the half-life. And these three factors impact the amount of drug that your patient is exposed to and for how long. So let's look at these individual parameters here. The volume of distribution is a theoretical volume that describes where a drug goes after absorption, or where the drug is distributed to after it leaves the plasma. I've included here a short list of things that alter the volume of distribution, and you should be able to see that some things like age, obesity, and edema are related to the patient, while other factors like binding in plasma or binding in the tissue are going to be related to the drug. Mathematically, we can express the volume of distribution as the ratio of the initial dose of the drug divided by the concentration of drug in the plasma, or the amount of drug in the body divided by the concentration of drug in the plasma. And what I want you to see from this simple mathematical expression is that the concentration of drug in the plasma is inversely related to the volume of distribution. As the concentration of drug in the plasma increases, the volume of distribution decreases. And as the concentration of drug in the plasma decreases, the volume of distribution increases. So you can see that this really reflects that the volume of distribution is an indicator of how much drug is distributing to the tissues. The second pharmacokinetic variable that I want to talk about is clearance. Clearance is a measure of the ability of the body to eliminate a given drug, and certainly there are numerous organs that eliminate the drug or metabolites from the body. So we talk about the lungs, we can talk about the skin, we can talk about clearance through the liver and in the bile. The most important organ related to clearance is always going to be the kidney. So in our sort of overall quick and dirty example here, then we'll be referring to clearance by the kidneys. Units for clearance are a little bit counterintuitive. They are volume per time, and I'm showing here milliliters per minute. This reflects the volume of plasma that can be completely cleared of a drug in a given amount of time, or in 1 minute. And clearance tells us, again, remembering that the kidney is the most important organ related to clearance, how the kidney handles solutes like drugs and metabolites here. Drugs that are rapidly cleared are going to be rapidly removed, and again, going back to this idea that the kidney is the most important organ here, we can say that these drugs are going to show up in the urine most rapidly. So drugs that have a high clearance means that they are rapidly going to show up in the urine. Drugs that have a low clearance mean that these drugs are going to be slowly removed and lost slowly in the urine. So clearly you would expect that clearance of the drugs by the kidney might change in patients that have impaired kidney function. If clearance decreases, then the amount of drug that's left in the patient can increase, and this in turn can expose your patient to toxicity. The last pharmacokinetic variable that I want to talk about is half-life. Half-life is time required for the concentration of the drug in the plasma to fall by 1/2. You can see mathematically that half-life is related to both clearance and to volume of distribution. Notice that the relationship between half-life and volume of distribution is direct. As the volume of distribution increases, the half-life increases. As clearance increases, however, the half-life decreases. So the relationship between clearance and half-life is inverse, while the relationship between the volume of distribution and half-life is direct. This should be intuitively clear to you. As we have more distribution of drug out of the plasma and into tissues, it takes longer for that drug to be removed from the body or to be cleared from the body. Likewise, if the kidney is working less well to clear drugs and clearance is decreased, then you would expect the half-life to increase again.